Hello, and you're listening to the Tiny Pet Podcast with myself, Dr. Nicole Sue, veterinarian, and my comedian partner,
Jez Watts. And of course, Dr. Nicole, my co-host, a tiny muscle-bound freak who can lift more than her own body weight with ease. Google double muscle disease, or the main villain of the 1988 Jean-Claude Van Damme action film Bloodsport to see just how bulbously built are the neck and back muscles of this freak of rabbit nature, and know that this is the woman I'm marrying. What are we talking about today, my love?
All the things I don't know.
My
what
very
back
strong
looks. I don't know what
partner.
it looks like because it's my back.
I mean, it's a very strongly muscled back. I mean, you very much enjoy having muscles. I don't think it's
it's very convenient.
You love it. You love
being
you love being strong.
It's very useful.
And you have just such a small frame, so it's like you end up the muscles just sort of pack on one another.
Yeah.
You don't have a lot of length to distribute.
It's really hard to find clothes that fit me.
That's true.
It's a problem.
Yeah, because you do a lot of like clothes shopping online, and then it arrives, and you're like, well, this
didn't work out.
This is just not built for this body.
Yeah.
Yeah.
Because nothing is.
Yeah, you should be wearing a loincloth and a headband, and you should be executing other fighters with your fists.
I wouldn't mind that, actually.
Yeah, you'd love it.
Anyway.
What are we talking about today, my love?
Vaccination reactions.
Yes. Can you do you get gigantic muscles from it? Is that what happened? Did you get vaccinated to the point that you became a gigantor?
No.
Oh, that's a shame, actually.
So vaccination reactions
Yep.
can happen to any vaccine that's given, human, animal,
Certainly, yeah, of course.
fish, I
It's-
guess.
as part of
they take.
the safety checks or whatever, they go, okay, it happened in this out of this many.
Yeah.
You know? Yeah.
Yeah.
Of course.
But just in the nature of it as well, when you're introducing something into the body, there's always a risk of a reaction.
Of course.
So,
I mean, that's the thing. There's an intended reaction, which is
yes.
yes, the creation of immune cells. But yeah, I mean, it's that thing of, as with all medicine, like there's like no medicine that's completely safe.
yes,
You know.
absolutely.
Yeah.
But also, especially with like immune type, medications or vaccines. And to be fair, actually any medication can cause it. So there are some immune diseases that are triggered by outside influence. So immune-mediated hemolytic anemia or immune-mediated thrombocytopenia. I was going to say that when I went. These are two immune diseases that can actually be triggered by anything. Vaccines are a common cause.
Sure.
In the grand scheme of causes, but it can be triggered by an antibiotic course.
Yeah, absolutely.
So I think what the take home is for this one is not to demonize it and be like, oh my God, it caused this reaction.
Yeah.
Because it's not something where, you're like, oh, mic drop. This is what the doctor doesn't want you to know. I'm like, no, I'm super aware
No, they
of
do
this.
want you to know, actually. They told you is the rules that they mention it.
Yeah. But also the mechanism behind it, it's not, something nefarious. It's just
Yeah, absolutely.
how it works.
I think it's like anything. It's because it can be a little hard to understand, I think, if you haven't studied it, been taught it. I think it's very easy to get scared of vaccines in particular because there's scary sounding stuff in it sometimes.
I've had medical personnel be, I got the flu vaccine and it made me sick.
I mean, it does.
I'm like, it does, but also that's not really what happened.
Yeah, but it does. I mean, that's sort of a little bit what it does. Like, it does create an immune response, which most of us feeling bad from, getting the flu.
Yeah, I think people also don't realize.
Most of it is the immune response. Is that make you feel bad?
Yeah, I think people don't realize that as well.
Yeah. But I mean, it is. It's. I think it's maybe less zeitgeisty of that people are afraid of it. They're busy being afraid of other things now.
Oh my God,
But
yeah.
a few years back, I feel like vaccines were like really like the big bad. I think hopefully it's less so the case now. I don't know.
I think
Do you
it
get a
is
lot of
less
pushback from clients?
not as much as I used to, actually.
Yeah.
So that's good.
Yeah.
But you still, I always talk about vaccine reactions before I administer a vaccine, and you still go, oh my God,
Is that like a legal responsibility to tell them? I would imagine, or is it not?
I don't think it's legal, but it's something I'm
Yeah.
always do.
I just had because I just had like a CT scan last week, and they were like, "All right, like you have to tell us if you're allergic to anything," and they sort of talked me through of like the things how it's going to happen, and I was like, "Yeah, I'm allergic to cat dander." Like, well, we're not going to inject you with cat dander. It's
I don't know. You are.
They were like, "No, you got to tell us." Like, they
do that to me as well, and I go, dust.
Yeah, allergic to dust.
So for vaccination reactions that are common and not concerning reactions, they usually last less than 24 hours.
Right.
So lethargy, common one. But for like, let's say the little puppies and kittens that come in for their, round of baby vaccinations, if they are lethargic, I'm never sure if it's the vaccine or that they've had a big day.
Yeah, sure.
Because they come in and everyone's like, sweet Jesus, let me rub you on my face.
Yeah. God, you're such a strange.
Why? They're so cute.
Listen, all right, yeah.
So maybe they're like, oh my God, that was a really big day. Met a lot of people, so they're sleepy. So I'm never sure if it's a vaccine or that. Yeah. Mild pyrexia or increased body temperature.
Yep.
And when I say mild, it's like couple of decimal points.
Yeah, okay.
If anything, so not like a 40-degree fever, something
just
where...
being a bit warm.
Being a bit warm, absolutely. Yeah. The person or animal should still be eating, drinking, toileting fairly normally. Mm-hmm. And what I tell people, if you're worried, give us a call.
Yeah, sure.
And what we might do if, let's say your pet does seem a little bit sad, miserable, we might prescribe a short course of anti-inflammatories. Yeah. Just to kind of reduce the effects of those things. But oftentimes, by the time you call us and you come in and you pick them up, they'll almost have kicked it.
Yeah,
by then. So those are the not concerning ones.
Yep.
And we do have concerning ones as well. And I do tell people about this. Mm-hmm. And it's hard because I don't want to scare them. But if it happens, you need to know.
Yeah, you
so
gotta be
that you can
informed
act appropriately.
To look out for it.
Yeah.
Yeah.
And the other thing as well is I'll always ask if they've had any vaccination reactions before.
Yes, of course.
And a lot of people go, oh, no, don't worry about it. I'm like, no, it's not. If they've not had it before, they're not going to have it ever.
Yeah.
It's a chance every time.
Yeah, okay.
So even then, like, it's still something that you need to listen and you need to be aware of. So the one that I always worry about is anaphylaxis.
Yes, of course.
So a severe allergic reaction to the vaccine. Mm-hmm. Usually for vaccinations, it happens with swelling, usually facial, but you might get swelling other places as well. So limbs.
And just for anaphylaxis, it's probably worth actually just in more simple language explaining what that is, right?
Really bad allergic reaction.
Okay.
Like really terrible, like the worst one you can get.
Yeah,
the one where,
like throat closing
exactly,
up
where you got to
because
stab them with the EpiPen,
Yeah, that kind of thing.
That kind of thing.
Yeah.
And that's why you need to come back in so we can stab them with an EpiPen.
Yeah, okay, cool.
Vomiting or diarrhea.
Yep.
That can cause that because it's just a massive histamine release.
Okay.
We don't have enough time to explain how that works.
Well,
you can Google it.
Histamine is like allergic response part. It's
kind of, and that
more
cascade, the inflammatory cascade.
Yeah, it's part of it.
Yeah.
Yeah.
You can get neurological signs as well, so ataxia or shaking.
Ataxia is
shaking.
Okay, cool. You're already using the simplified language. Great.
Yes.
Love it.
I've done this before.
All right. Sometimes you just say an incredibly fancy term and look at me like I should know what it is. I'm like, I don't know.
Shaking or tremoring. Yeah. That's something to be concerned about. Or it can sometimes have seizures as well.
Okay, interesting.
Yep. So for those similar,
maybe for the last couple of weeks, I've just you've been vaccinating me in my sleep, and that's why I've been so nervous and shaking. Is that it? Have you been vaccinating me?
You're now fully immune to canine distemper and rabbit hemorrhagic disease virus.
I actually would love to be
so immune
to distemper. That would be sick. Yep. Okay. Shaking.
So actually, really similar to any other anaphylactic reaction.
Okay.
Now, the other ones I mentioned before, like immune-mediated hemolytic anemia, the immune-mediated disease that can be triggered by any vaccine, medication, whatever.
Right.
They might show similar signs as well, but it often takes a slightly longer course. So over, a week or something, people might notice some things. Again, if you're not quite sure, just get in touch with your vet.
Yep.
Often they'll be like, come in. And what I tell people with that, I'd rather you come in and have me be like, oh, actually, he's totally fine. Than you delay coming in or being like, oh, no, I think... some people say that they're worried that they're wasting my time.
Yeah, I understand that.
But I'm like, no, I'd rather you come in and for me to be like, he's fine, than for you to not come in and come in with a really, really unwell animal.
Yeah, absolutely. But yeah, you also don't want to be like an idiot about it. Like, you don't want to feel dumb. You don't want to, be like, oh, no, something's wrong. Like, that's just regular being a dog.
Yeah.
Sometimes I'm sure there are people who come in who are bothersome.
So a really common one we get is people coming in for a tick on their dog, and it's a nipple.
That's cute.
And then when we go, oh, don't worry, it's nipple, they go, but he's a boy. And I go, sir, do you have nipples? Because I think you do.
Yeah. Okay.
I don't need to see them, but just take a moment and think about what you just said.
Yeah. That's funny.
Yeah. Cool. That's it.
I was just sorry. I really didn't expect that the end of the episode about vaccine reactions was going to be the establishment of men's nipples.
Neither did I. That was not in my notes. It just came out.
The Tiny Vet podcast is independently produced.
To support us, go to patreon.com/tinyvetpod. Please like and subscribe. Hug your